Hi, everyone, and welcome to episode 257 of our Tick Bootcamp podcast. The title of today's interview is Vital Side, an interview with Lindsay Mitchell. My name is Matt Sabatello.
My name is Richard Johannesson.
Brain retraining is one of the many tools used by people that have successfully recovered from chronic Lyme disease. Lindsay Mitchell has become an expert in brain retraining and has used it in her own healing journey. She's developed her company Vital Side and is now helping many people in the community regain health and get their lives back. Without further ado, Lindsay Mitchell in Vital Side.
Hey, Lindsay Mitchell from Vital Side, and welcome to the Tick Bootcamp podcast.
Thank you very much for having me here today.
Well, it's been a long time coming, Lindsay. We've targeted you for the hot seat at Tick Bootcamp, and unfortunately, because of all kinds of scheduling challenges, it's taken us until now to get you here, but we are now really excited to have you. So first, introduce your business to our community. Talk to us about Vital Side and what you do at Vital Side.
Sure. So yes, Vital Side is my business. It's a brain retraining community. So I work with people who have chronic illnesses and chronic symptoms. And I teach them about the healing properties of the nervous system and how that impacts the physical body. So we go through structured techniques and protocols on how to shift and change that brain and body communication to really benefit your physical health.
So how long has Vital Side been in business, and what are the different elements of Vital Side that you offer to the community?
Yeah, so this has been going on, it's about 4 years at this point. So I started Vital Side pretty soon after I recovered from having Lyme disease. And at this point, it has continued to kind of evolve and change. So I offer a lot of free stuff, a free community, public cohort where I offer like free videos, free advice, all of these things on the Vital Side Community Network. And then from there, you can start to do different programs. So I have this 4-step method where you start with first resetting your autonomic nervous system with like a 7-day free trial. And then you can join the Vital Side membership, this is where I teach a more comprehensive structured tools on how to shift out of a state of hyperinflammation, hypervigilance, people who are dealing with that kind of limbic system impairment, which I know we can talk about a little bit later. And those are tools that you can use throughout the day, and then a longer tool that you can use daily to kind of retrain that survival response, that sympathetic dominant fight, flight, freeze response that can be going on when you have a chronic illness like Lyme disease. And so that is in the Vital Side membership. Step 3 is Elevate Brain Retraining 2.0. And this is for people who have brain retrained in Vital Side or another program. And then we go through how to personalize your practice, make it more yours. What if I can't visualize? We go through that and Elevate. And then step 4 is, what do we have? Regulate. That's number 4. And that's
Reset,
regulating.
Rewire, elevate, regulate, right?
Yeah, that's regulating your autonomic nervous system, which is an important part of life. So that's live sessions. We have a state changer hub in there. So there's within this community, you can have like private sessions, group sessions, in addition to the virtual courses. So it's really cool the way it's structured and set up. It is all community based. So, I know that's so important to y'all, and it is such an important part of healing. And, that's what we lead with. So I'm really proud of how far it's come and where it is now.
It sounds like you've structured this around a very powerful value ladder where you have folks who can do it on their own with all the information that you're offering through the free elements of your community. They can do it together with you or some of the tools that you're offering through your 4-step process. And then, of course, they can have it done for them where they have this one-on-one coaching. So you have every element of a value ladder available to folks, and you could meet them where they need to be met.
Yeah, absolutely. I'm one of those people who, when I start something, I'm like, I want to do it on my own. I want to learn it first, and I want to learn all the information, and I want to start doing it on my own. I just, that's kind of naturally how I am. And so I go from 0 to 100. So then I put 100% effort into it, but then I may stop and say, wait, I need some support. Like I need some accountability. Like I need someone to ask questions to. So that was kind of how I decided on this current model. It hasn't always been this way, but I wanted, those people who were kind of like me wanted to do it on their own. And then if they had questions, they could chat with me. And then if you kind of know you're the person that needs community, wants that accountability, just, from the start, you can have that too. So you can kind of piece it together and you take what you need, which I think is a helpful approach, because brain retraining isn't one size fits all. Everyone is so different and so complex. So it's nice to have different options.
I really like the way you've built this so that folks who need more support, or folks who want shortcuts, or for folks who want to find a shorter path can use any step in the value ladder that works for them. And it's really, I think it's powerful that you're giving folks an opportunity to validate this however they need it to be validated. So that's I can't tell you that I would do it any other way, and I do want to compliment you for the way you built this out, which is one of the things that Matt and I learned when we were looking at your material. So let's talk about your background. I understand you're living in Texas, but you're really a California gal. So talk to us about where Lindsay got her start.
Yes, I live in Austin, Texas now, like half of the world, I think, at this point.
Certainly half of California.
I am originally from California. I haven't actually permanently lived there since I was about 12 years old. I traveled, everywhere in between as a kid. And when I got to college, graduated from college, wanted to go into medicine, ended up going to a physician assistant school in Worcester, Massachusetts. And from there, I just wanted to travel. I was like, I just want to go. I just want to travel. I just want to be, on the move, on the go, practicing medicine. And so that's what I did. I traveled every 6 weeks for about a year, and then started working as a travel physician assistant. So I worked in like really rural communities, and pretty much around the US. I lived in Bolivia for a little while. And I loved medicine. I still love medicine, loved to travel, but that's when everything kind of came to a head at one point when I was, within that travel, and I was bitten by a tick. And, within that year, I was like traveling so much, and I thought, the symptoms I started to get, I thought it was like jet lag. I thought I was tired, just kind of headachy, groggy. And, turns out a couple months later, I recognized that, I had Lyme disease, and, definitely had to hone in and treat that. So spent about, a year of my life doing that. Which is very short compared to a lot of people, which is amazing.
There's a lot to unpack there, Lindsay. So let's start to do that. So talk to us about when you first found that you had a heart for healing, and what drove you to the medical field.
Yeah. So it's funny. I was born that way. I was born, and I knew, I really wanted to help people. And I know that's kind of like a general slogan that a lot of, people who are in the healing space use.
Well, let me challenge you there, because I don't think it's a slogan. I think it's the way God has made us. We are supposed to be living a life of contribution. We're supposed to be helping other people. So I don't think you were born anyway other than the way you described yourself. And I don't believe it was a slogan.
Yeah, and I definitely agree, but I do think that people have different levels of that. I don't think everyone has the same purpose. Everyone's supposed to do something in this way. And so maybe Absolutely. Then to kind of clarify that, I kind of was born thinking like, yes, there was 100% something I was going to do in the healing space. I had a little blue doctor's kit as like a 4-year-old, and I would carry that around with me with like the fake scissors and band-aids and stuff like that. It also helped that everyone, my mom was a surgeon. A lot of my family was in the medical field. So I was surrounded by that as a kid, though I did have quite a bit of empathy. I've always been, a very compassionate person. And so that, caused me to make a lot of the choices that I did throughout my life. So I knew that I wanted to work in the healing space. I didn't really know in what capacity, and I have a lot of different passions. I love to write and to read, and I liked to act as a kid. Like there was a lot of things that I just enjoyed doing. And I think, having gone through my own trauma as a kid, dealing with abuse from my dad, and, going through about a year of that as a kid as well, and then getting out of that situation, that also just kind of reinforced my own strength. And, unconsciously, I had carried with me this idea of I want to do something, to help other people who maybe can't help themselves or are struggling in some capacity. So I think that was this unconscious thought. And, a lot of our choices too, or a lot of our traumas really shape our choices, which isn't necessarily a bad thing. If anything, it can reinforce our purpose or, our passions in life. So I then, when I decided I wanted to go to PA school, well, actually, even before that, when I went to college and I was studying biology, prior to going to college, I thought, okay, let me study the hardest thing I can think of. And if I don't like that, then I'll do something else, because I like a lot of things in general. So that's what I did. That's why I, studied biology with an emphasis in molecular biology, and worked in a research lab for about 3 years. And I loved it. I really liked it. And I was like, oh, okay, this is something that, makes sense to me. But working in a lab, I need to be around people. I'm such a people person. I love working with people. I just love people in general. So that was my true passion. And then decided, found out what a physician assistant was, decided that's the route I wanted to go down very fast in college when I was about a sophomore, just because of the variety of things that you can do with it. That's what I loved, because I love variety. So being able to, it was really appealing to me that I could deliver babies and do surgery and, work in a clinic and do all these different things. That was very appealing to me, which I did end up doing, which is so cool to have experience in all these different fields. And so that's what I did. So I studied physician assistant, got to travel. And just throughout my life, there have been moments in my life, very profound moments where I'm like, this is what I'm meant to do, meant to help people heal in some capacity. And I always tell people I'm so passionate about people feeling good while they're alive. Because everybody dies, everybody goes through that in the human experience. And so how can we optimize our human experience, right? Connect with joy, connect with peace, connect with our own ability to heal and have health, I think is so important. So even in my, practice working as a PA, that's what was always forward in my mind. People, my people were working with me, they'd always be like, okay, let's go, speed up, let's go. We got to see patients in 10 minutes. I'm like, I have to talk with them, and I have to let me hold your hand, tell me what's going on. It was always the human experience first. It was always the person first. And so, that has always been something that I prioritized.
So Lindsay, part of optimizing life and optimizing your health is avoiding environmental risks, environmental threats. And I'm wondering, as the daughter of a doctor and as a biology student who ultimately made her way to the Lyme Belt to go to PA school, what you knew about ticks and tick diseases when you arrived to the Massachusetts Lyme Belt.
Well, I did learn about it in school, and
Which level of school? In elementary school, in high school, in college, where?
In the Lyme Belt.
Okay.
In PA school. Prior to that, I had like randomly heard about it from people who, whose family member maybe was sick with Lyme disease, but it was rare. And yeah, then you're right. Then I moved to Massachusetts, and then I lived in Connecticut. I lived in different parts of Massachusetts, very close to Lyme, Connecticut. And so I did hear about it a lot more there. We were taught, and I learned how to treat it in PA school. It was very kind of step by step, a lot of the things that I learned in school and in general, the textbooks are all antiquated, a lot of the information. So it was treatment or, diagnosis, Western blot. I think that was pretty much the only test that was going at the time when I learned about it. But on a practical exam that I had to pass in order to get into my rotational year, one of my patients, who were quote unquote patients because they were actors, was presenting with Lyme. So it was very interesting. It like gives me goosebumps to this day of how, and I think I have to be totally honest, I think I missed it. I think I did not diagnose it correctly. And that mortifies me. But I did pass the practical.
Is that just foreshadowing?
Right. I did diagnose an MI that presented very weird, heart attack, basically. But I did not get the Lyme, right? Foreshadowing. I don't know what you want to call it, but it makes total sense because, again, Lyme is endemic to this area. It can present very, with a variety of different symptoms, and I missed it. And you know what it did, though? It made me never forget how to diagnose it. So that was always stored in my memory bank because I did not want to fail again. I did not want to not pick up on that again.
Well, and again, maybe in the spirit of some foreshadowing, you were being prepared for what you were about to encounter, and then ultimately where that was going to take you. But we'll get there in a second, Lindsay. Let's focus a little bit more about that training that you received. Were you trained on how to protect yourself from this threat? Meaning, were you trained on how to check yourself, and were you trained on regularly checking yourself because you would find yourself in a position where when you're in the Lyme Belt, you're going to get bitten repeatedly? Or were they just teaching you how to diagnose this disease when they were clinical presentations?
Oh, definitely the latter. I never received 101 information on how to protect yourself. Nope.
So now let's fast forward to Lindsay being out and about, right? She's a gal that needs a lot of variety. She's a gal that is going from place to place. She has a heart to help people all over the world. And now you get bitten by a tick. So let's unpack that a little bit. Where were you? What were you doing? And how did you discover the tick biting you?
Well, I was in the Redwoods in California, and I had just met my husband at the time. And we had kind of decided to go on this world trip together, but I was finishing up a travel job outside of Salinas, California. So we were doing a redwood trip and we were camping there. And I think that was my husband and I, we met and we decided to go traveling together. It was kind of this kismet connection. So it was maybe like our third time hanging out. And I have a picture of me hugging a tree, of course, me lying on top of this tree, and I'm hugging it, and, I'm fully kind of clothed head to toe, covered, in a flannel, leggings, these types of things. And soon after that picture was taken, I felt something on the back of my neck, and my husband looked, and sure enough, it was a tick. And so it bit me, right in the back of my neck. So he found it. And in school, I didn't learn about proper tick removal. And so we did our best at getting the tick out, and kind of like, him being able to kind of look for the head, or look, as close as it was in the skin to kind of get it out. And that's what he did. And honestly, after that happened, I didn't think about that experience, until 6 months later. I remember having a conversation with a girlfriend on the phone about getting bitten with a tick, who's also a PA. And I remember confirming with her, I was like, well, Lyme disease isn't endemic to the redwoods. She was like, no, I don't think you have to do anything about it. And so that was my experience.
Okay, so let's pause there for a second and examine that a little bit further. So you rub your hand across your neck and you feel a bump on the back of your neck. Your boyfriend, now husband, removes it how? With his fingers, with the tweezers, with what?
We were camping and we didn't have tweezers, so with his fingers.
And then what did he do with the tick after he pulled it out of your neck?
Flushed it down the toilet.
Okay. And then after that, did you take any steps? So for example, you folks who are trained as PAs, you medical professionals, of course, were given training on, for example, watching if a rash would develop. So did you take any steps to put a circle around the place where it was bitten? And were you looking in the mirror to see if there was anything developing around your neck? And or did you take any steps to support your immune system so that you could protect yourself from whatever was spit into you, even though you weren't in an endemic area, or at least you thought you weren't, based on the sister science that was exchanged between you and your fellow PA?
I think a lot of medical professionals can relate to what I'm about to say. You don't typically think of yourself in that clinical setting, and you don't really put your own health in front of as a priority, really. And I, totally admit that. And, when I was working as a PA, it was everyone else's health in front of me. If I had a cold or a flu, I'd be like, oh, okay, let me just, do my best to feel okay so I can show up for everyone else. And I took that same mentality, to this situation. And so looking back, I could feel like a sense of shame or guilt or something that I didn't take any of those steps. But that is where I was at that point. And so, no, I didn't take any prophylactic, care in trying to, see if there was any rash, kind of keep track of what was going on, protect my immune system, because honestly, that wasn't a priority for me at the time.
Okay, so let's unpack that a little bit more, because I find it to be really interesting and certainly not an issue to be ashamed of, right? Are those of you in the medical community who had the mindset that you had at that time, do you believe that you're not going to get sick, so therefore you don't have to take care of yourself? Do you believe that you can take care of other people even though you yourself are not in a healthy place? Do you believe you're not entitled to it, that only the people you're serving are entitled to care? I mean, I don't understand why that would be the mindset, because I don't know how anyone could believe that they could take care of someone else if they themselves were not healthy.
Well, I don't think I exactly resonate with any of those statements. I think it's the caregiver mentality. I think if you are a caregiver, by nature or by profession or whatever it is, and you kind of resonate with being a caregiver, you naturally just put everyone else in front of yourself and take care of other people. So I don't think I had a conscious thought of, well, I can't get sick, or, well, I'm impervious to illness, or, well, there was no conscious thought about that. It was more so, I'm the caregiver, and so I'm here to give care. And for me, I addressed myself when I was sick. So if I got, I did get a lot of colds and flus and stuff like that. And then I would take care of myself during that time. But if I'm totally transparent, which I am being, I didn't take that prophylactic care in general of my health when I was treating other people. That wasn't a priority to me. I was just, as a young medical professional traveling around, it wasn't something that was on my radar. So looking back, prior to that specific situation, I mean, I lived in mold-ridden huts in Bolivia. I drank, water and got sick from that for a month. There were a lot of situations that I dealt with at the time because, honestly, I didn't prioritize my own health. That's not something I learned until after having experienced this. And I love how I have experienced now like this prioritization of my health. But I think if I hadn't gone through an experience like this awareness wouldn't be there. And so it is interesting how that has happened, but no, at the time, it just wasn't a priority.
So Lindsay, and I don't know that it's necessarily, unique to medical professionals that they take for granted their immune system or they take for granted their health, because I've had exactly the same experience that you've had as a result of doing this podcast, right? I took my immune system for granted. I took my health for granted. Of course, I was always healthy and my immune system always worked. So why should I worry about it? And then I started to see the very intentional way that people who have gone on this journey have lived their lives. And it's offered me an opportunity and insight into how I should be living more intentionally, right? So I don't think it's necessarily unique to medical professionals, but there is a piece of this I do want to explore with you in a little more detail, because one of the bad experiences that I had after a tick bite just before we started this podcast was I called my doctor's office and I asked to go in to be treated prophylactically. And the gatekeeper said to me, "You don't need to come in unless you have symptoms. Why are you trying to come in?" So I think part of what we, what we have here as people who are living in the West with a Western medicine mindset is that we don't treat until there are symptoms. We don't treat until we're sick. We just take for granted that our system is going to remain healthy. And in some cases it is, right? So let me ask you another question, because ultimately you do get sick, right? You start to get symptoms sometime in the next several months after your tick bite. How long after the tick bite did you begin to exhibit symptoms of what you now know to be Lyme disease?
Yeah, so it was about maybe 3 months, anywhere from 6 weeks to 3 months. I remember getting like a pretty bad flu when I had just flown to Ireland. And we were supposed to go to this, camping trip that weekend. And I had to go late because I was just in bed for about 3 days. And it felt like a flu at the time. And then after that, I did make a little bit of a recovery from that kind of acute illness. And then as the months progressed, I started to get migraines. And then it was once a week, and then it was like twice a week, then it was every other day. That really impacted me. I'd never had a migraine in my life. And then after the migraine started, that was when I started to just become a little bit more hypervigilant of my environment, kind of sensitive to smells. And basically soon after that, I had this anxiety because I didn't know when I would have these symptoms, when they would present themselves, and at the time, again, I thought, well, it's probably jet lag. So I was treating myself for jet lag. And again, because I'm not thinking, really prioritizing, okay, let me sit down. What could be going on in this situation? Like you said, you've never had an experience like this. You're like, okay, well, I'll just kind of treat as I go, like treat the symptom. And that's what I was doing. And so about probably then 5-6 months in, then I started to get the joint pain. And that was a very big symptom for me. Just fatigue and general malaise. And by the time we had gotten back to America, that's when I knew something was wrong.
Now, you shared with us earlier in the podcast that you were taught about the symptoms of Lyme disease. You had a clinical presentation from an actor with symptoms, although you were kind enough to share with us that you didn't diagnose the actor with Lyme. When did you first start thinking about Lyme disease, despite now having some very classic symptoms that you've just described to us?
Yeah, so I was in West Virginia, and we had just okay, so I, like a lot of people, push myself, and again, don't prioritize myself. I agree that's not specific to the medical profession, but it just happens. I think, I'm just kind of more aware of it because I'm treating everyone else and not myself. We're at this family reunion, and we had gone mountain biking, and I remember I was in tears coming back from that mountain biking experience because I couldn't really do it. I had to stop. I was in so much pain. I was scared. Like, I didn't know what was going on in my body. And so my husband and I were sitting kind of on the back porch, just kind of processing what had just happened. And at that moment, he had a tick on his arm, and he like flicked it off. And he was like, remember when you had a tick? I laugh, it's dark humor. And I said, yeah, I do. And then it just all clicked. Like in that moment, I just got this like visceral, it was just this like, physiological shift for me. I was like, this is Lyme disease. Did I miss it again? Shoot, I missed it again, right? So, and I knew at that moment, I was like, I have to go get tested for Lyme disease. And I did in West Virginia. And then I took the steps to begin that process of treatment.
So did you treat with any doctors between the time that you first showed your flu symptoms and the time that you finally had the epiphany, sort of smashed in your face with the tick on your husband's arm, that you had Lyme disease?
I hadn't seen anyone. No, I was traveling mainly international. So nope.
So last week we interviewed a brilliant researcher who shared with us that there's a group of people who get bitten by a tick who never get sick, right? Tick bite does not ever affect them because of a number of different factors. There's another subset of people who get bitten by a tick. They present acute symptoms, they get treated, it never becomes chronic. And then there's a third subset of people who get bitten by a tick and ultimately become chronically ill. And there are a number of different factors that could cause someone to become chronically ill. And some of them are physiological, some of them are emotional. And since we have the vital side gal here, I can't help but to ask, what do you think was going on with you at that moment that you ultimately became chronically ill? Do you believe it was the immune disruption from air travel? Do you believe that you were carrying some trauma with you? You just share with us that you had some trauma during your childhood that you had to learn to manage. And one of the things that Dr. Horowitz shared with us a couple of weeks ago is that one of every three of his female patients have suffered some form of sexual trauma prior to being diagnosed with Lyme disease, and he had a whole interesting perspective on that. So what was going on with you, and what were the immunosuppressive events that were going on that caused your body not to be able to fend off the microbes that were making you chronically ill?
So before I answer that, I just want to preface it with, I think after we've experienced a chronic illness, we always want to do this kind of connecting of the dots as to what has happened. And that's satisfying for us as humans, right? We get this sense of like almost resolute that we can kind of connect the dots and know that this is really what happened. And so I've done that so many times, I'll never exactly know. And I'm okay with that. And I think there are sometimes, just things that we just don't know and we won't know. And we can do our best to kind of gauge. And so what I'm going to be doing is, hypothesizing what likely for me was the tipping point.
but I think it's more than just hypothesizing and trying to get to, I'll use your term, to a place where you have satisfaction or resolute. I think it's also a process of re-engineering, right? If there's a process that causes us to get sick, then maybe we can reverse engineer that so that we can overcome the illness. So I think it's more than just wanting to have an answer. It's part of the healing process. Or do you disagree?
I think it's a possibility depending on what those factors are, and maybe some can be prevented, but a lot can't. And, in my life and the events that led me, to this moment, there were a lot of experiences that I wouldn't necessarily have been able to change or would change as a result. So hopefully there are things that are possible to change. And there are definitely in people's experiences. But in mine, there weren't many that I would have changed. That makes sense.
Yeah, no, it does make sense. But I don't think it's about changing, because obviously we can't change what's happened in the past, but maybe we can be more intentional about managing it. Maybe we can be more focused on it, right? Because I'll use your example that you had given us before, right? You were somebody who was a caregiver, right? And because you were a caregiver, you weren't particularly intentional about protecting yourself from threats. You weren't particularly intentional about identifying ways of prophylactically protecting yourself. You weren't particularly intentional about those things. But if you now think through how you were living and what kinds of things you were not maybe overcoming or focusing on to heal from, then you now perhaps have a path toward healing that you wouldn't have had if you weren't thinking through, for example, whether or not you dealt with the trauma that you had maybe just put in a box somewhere, or you would prepare yourself for air flight differently. Or, there are a number of different things that, we can unpack here, but I think it's really more focusing on things that we were maybe taking for granted, or focus on things that weren't we should have been more intentional about. Not that that's a criticism, but because we all live our lives that way. And that's a path to getting better.
Right. And I think, looking back on my own experience, I did what I could about the things at the time. At the time, like airborne was really popular. Like I would take that on a plane, right? These types of things, or like the trauma I had as a kid, I went to 10 years of therapy. Like I did a lot of that work. So, if I were to look back and, put my shoes into the Lindsay of that time, I was doing my best. And, it just isn't always going to be the thing that necessarily helps. So then to answer your question about like the different events, I think, my perfect storm of kind of experiencing those chronic symptoms, it was a combination of things. I think, having dealt with the acute illnesses that I got from traveling and not maybe properly identifying and treating what was going on there, like the parasites and these different things that I was exposed to. So there was that sort of toxic overload that I did have to deal with, that I was experiencing. And in addition to that, I think that when it comes to trauma, I think there are many modalities that can be modalities used to process trauma as a kid. And I don't think those were really that talked about. I went to a lot of talk therapy, which, pretty much every talk therapist that I went to, it was like, oh, you're good. You seem to be good. Like, you seem to be happy. You seem to be living your life. And it wasn't trauma processing modalities or coping skills that I was taught. And so I think of course, when you experience, abuse and trauma, that does live with you, and it comes out in different ways, in the physical body, in kind of different situations. And so I think that was a combination of, as a child, having experienced that trauma, my primary response kind of being this fight or flight response as a mechanism of survival. Get out, run away, and or stay and fight. And so I think throughout my life, that had been kind of my go-to response when things got tough and challenging. And that had become this pattern. So yeah, there was this nervous system dysregulation as a result of trauma. There was a toxic overload. And yeah, it brought me to that tipping point, or, my perfect storm of my body basically saying, okay, no more. Can't handle
Lindsay,
it anymore.
We interviewed a fellow named Bob Miller last week, and one of the things he shared with us is that we're already living in a toxic pool, all of us, between the plastics that we're coming in contact with, the mold we're regularly coming in contact with, the EMFs that we're coming in contact with, the changes in our diet. And he was attributing sort of this toxic pool that we're all sort of swimming in as the reason why Lyme disease and chronic Lyme disease is so much more prevalent today than it was 50 years, 100 years, or 150 years ago. And again, there are a lot of different people who have different theories about why that's the case. But his theory is we're living in sort of toxic pool all the time. And then, of course, we have Lindsay, who's out and about, going to all these foreign countries and bouncing around, and now coming in contact with parasites and coming in contact with, with water that isn't potable, and you have all of this sort of coming together at the same time, and then tick bite, right? And when you bring that whole combination together, where we all now have an increased predisposition to getting sick from these types of microbes, because we're just swimming in this toxic pool generally, and then you bring even more toxicity to your experience, you then just get sick, right?
Yeah, I think that was my perfect storm, and couldn't handle after that tick bite, my body couldn't handle anymore.
So Matt's going to pick up from here, and he's going to talk to you about your treatment journey. But I'm interested in talking with you for a couple of more minutes about the fight or flight mode, and how your childhood trauma put you in a position where you were in and out of fight or flight maybe more often than someone who would not have been in trauma, in that traumatic experience, and how that was immune disrupting as well. Can you unpack that for me a little bit?
Yeah, so when we have experienced a traumatic event, whether that's psychological, physical, mental, emotional, our nervous systems respond, specifically the autonomic nervous system responds in order to keep us alive. And that's what our survival responses are meant to do. And they're meant to be turned on when we need them to be. You know, I needed that response to be turned on as a child. Not to say that's the only way that that turns on. You know, if we're driving on the freeway and we stop short because the car stops in front of us, you can feel that fight or flight response turn on. And so there are many ways that we go in and out of these survival responses throughout the day. I just happened to be exposed to a prolonged time, you know, about a year of psychological and physical abuse, and that kind of being my primary response to keep me alive. And so the survival responses are meant to keep you alive. But because I had prolonged exposure to this danger, as many people do, prolonged exposure to a virus, prolonged exposure, you know, to a mold-ridden house, these different experiences that can cause our nervous systems to be kind of dysregulated in this way, then we can get into that chronic state of survival or chronic fight or flight or chronic freeze response. And what happens when we are stuck in this state of survival is our body is hyper inflamed. I mean, we have this inflammation that exists. We're hyper vigilant. We're focused on surviving. So how do we get out of this danger? And so, you know, there's a combination of symptoms that can occur. The heart can beat faster. You can breathe faster. Blood flow gets sent to the hands and the feet, not vital organ systems that help you to digest and metabolize and rest or sleep, right? Sleep can be greatly impacted. We're solely focused on getting out of danger. And so it negatively impacts the body when we're in that chronic state of stress, that chronic stress response. It impacts our physiology, our hormones, you know, how we're able to connect with other people. There's so many areas of our lives that are impacted, but one of them is the immune system. The blood-brain barrier in particular, these blood vessels in our body, like responsible for weeding out toxins, can become more permeable. So we're more susceptible, you know, and it's harder to fight off infections. Our immune systems are not crucial to our survival when a danger is present. That's acute in that way. So the emphasis is taken off of the immune system. And so that can definitely have those long-term effects if we are in that chronic stress response, as opposed to that kind of balanced responses we have throughout the day.
So Lindsay, you argued that the fight or flight mode, or the triggering of your survival software, is a good thing in an acute arena under the right circumstances, but having too much of it for too long, where it becomes chronic, of course, is not a good thing, right? And so you believe because you were exposed to prolonged trauma, ultimately that fight or flight mode became sort of an emotional home for you, and you were constantly in a place where your body was in fight or flight, even though you didn't have any threats triggering the response.
Right. So the threat was present for about a year. And then my brain, you know, our brains being malleable, neuroplastic, was kind of almost, you know, can get addicted to this response. And this was the trauma response that I was in, you know, this constant cortisol and adrenaline production that I was experiencing as a result of that. And so after that happened, that did become my primary response. It wasn't always 24/7, but at that point, it was kind of my go-to. If a challenging or perceived dangerous event happened, then my brain and then my body would go into this response, you know, something that maybe mirrored the experience of like a change, a move, you know, these types of things. And sometimes we don't know. Sometimes we don't know exactly why it gets triggered, but it you know, primarily did for me as a result.
So one of the things we learned from Dr. Diane Mueller was that when we get into this loop, our cortisol receptors ultimately become retarded, and they do not now properly trigger through the HPA axis the adrenaline. And it's sort of like, it sort of becomes this loop, right? Where you're getting more adrenaline, you're getting more adrenaline, you're getting more adrenaline, because it's not, because the triggers have now become damaged, because you're sort of in that loop. So talk to us about what it was like for you. And do you agree with Dr. Mueller that the loop develops, and there's a physiological loop that's developing as a result of you having had this prolonged experience of trauma?
Yeah. So yeah, that stress response, that HPA axis, that's, on the cyclical loop. And it's interesting because this can be triggered, like you said, without the danger being present, simply as a result of our brains responding to traumatic events. And again, trauma doesn't have to be specific to a big T trauma like I experienced abuse. It can be, a small car crash or a diagnosis that your dad received. It can be so many different things, little T traumas that may have added up and, happen throughout your life that you're not even aware of. And I think, everyone is so different in how this can be kind of triggered in this way. But yeah, that's exactly what happens. And there can be, sometimes there's a little bit of confusion of like, okay, well, I went and got my cortisol tested and, some people are high, some people are low. I think ultimately it's this dysregulation of cortisol that happens because our bodies maybe have run out of cortisol and they can't produce anymore as a result, or, we have that increase and there's just this fluctuation. I think that's what I would kind of go off of if you're thinking about the actual lab result. There is this dysregulation.
So Lindsay, talk to us more about your treatment now, right? So you had this perfect storm and you had this tick bite, you had these parasites, and you had a lot of other environmental triggers as well, and trauma triggers. So once you had this diagnosis and you were really sick, what was your first course of action to treat?
Well, having been trained in kind of that typical, Western medical training, I, was aware that there was a bacterial infection. So I started with antibiotics. I think that's, what a lot of people start with. And so I was on that for about 2 months. Until I noticed that there was no change. And then I continued that course of treatment. And then as a result of kind of seeing a couple different practitioners, I had one practitioner tell me, well, you're a young woman, you'll probably just grow out of it and get better, just kind of like treat the depression. And which was confusing because I didn't think I was depressed. I knew I was sick. And I had been to a couple different practitioners, and then I was kind of thinking, okay, I have to go beyond what I know, beyond this kind of Western medicine. And that's when I found a couple integrative and functional docs that started, looking at the parasites, looking at, co-infections, that started kind of treating the co-infections, going down a detox path. And that definitely resonated with me more because I just wasn't seeing any results with like the current path that I had been on.
So Lindsay, you were diagnosed with these parasitic infections while you were in rural Africa, right? And they never did anything to treat you at that time. So you had to wait until you saw a more natural doctor to treat those parasites?
So when I was in Bolivia, I did get sick with, just as a result of history, I knew it was a parasite. So I actually wasn't diagnosed, like there was no lab result. So it wasn't until years later that I did get that diagnosis. And that was from stool samples from an integrative practitioner. So at the time, I think I did treat with like a general antibiotic treatment, but I never got that diagnosis of having like a parasitic infection. So by the time I did see an integrative practitioner years later, yeah, that's when I started treating for that.
Gosh, and I apologize, Lindsay. I believe it was South America. I said Africa. I know you were in Africa at one point, but I think you got the parasites in South America, right?
That's right. Yeah.
Okay.
I mean, that's what I think.
So
that's what I believe to be true.
But what's really interesting here is so many people all the time ask us at Tick Boot Camp, how do I know if I have parasites? What testing is available? So do you recall what testing you did through your natural doctor to determine that you actually had parasites?
I don't know what the exact test was. And at this point, years later, I know there are a lot of different tests, but it was a stool sample test. And I don't know the exact name of the test. I know he still does it because I'm still friends with him today. But yeah, it was a stool sample.
Are you comfortable sharing the name of the doctor?
Yeah, Dr. Wallace Taylor. He's here in Austin, Texas, and he's still a good buddy of mine.
So talk to us about the transition. So obviously the antibiotics weren't helping. And I guess before I ask this question, how long in total were you on antibiotics for before you made that pivot away from Western medicine and antibiotics?
I was on antibiotics for I think it was about 3 months. And at one point I had tried to go off of them. And it was almost, and I don't really know how to describe it because I had never heard anything like this before, but it was almost like I had developed, like my body had developed this addiction to taking them. And I was uncomfortable getting off of them. And I told my practitioner at the time, and he was like, well, just keep taking them. So I kept taking them. So by the time I saw Dr. Taylor, I was, had already been on this long course of antibiotics, and I really wanted to get off. It just wasn't, I knew ultimately that for the short term, my body was addicted, but for the long term, it was ruining my gut biome. And so I knew I wanted to get off. So yeah, it was about at that 3-4 month mark that I did get off. I'm pretty sure that's what I did.
And that dependency or that need to stay on antibiotics to feel quote unquote well or partially well is not uncommon. And we call it the antibiotic loop, where people will go off, feel worse again, and then have to go back on antibiotics. And they get stuck in this cycle or this loop until they find another way to ultimately get themselves back to health. So now when you're treating with Dr. Taylor, talk to us about what you were doing specifically now outside of the Western and antibiotic world to help treat your Lyme disease, knowing that the antibiotics weren't really effective in your treatment.
So there were like a number of prescription medications that I did use at the time to kind of treat, I was on an antiparasitic. It's tough to really recall exactly what I was on because I did a lot, and there were a lot of supplements. So there were like natural supplements, there were the medications, and then they were the ones that were used for detox. And, then there were, NAD, IV treatments. There were other types of.
Sorry, give us a little more detail about the ones you do remember. So like NAD, for example, what is NAD and what was it used for and how did it work for you? And if you can, whatever you recall as far as, obviously you're on a lot of pharmaceuticals, herbs, and detox tools, whatever you can remember, if you can let us know what those tools were and how they were effective or not effective in your healing journey.
So I know that this podcast, people do get a lot of help kind of hearing from what other people, what they did exactly. But for me, I can't really give specifics as to what helped and what didn't. So I'm not totally, sure that that is helpful information, because at the time I had done so much. And so it was really hard to link, like, this is the exact thing that worked. I was on Myers cocktails and NAD and like all these different IV treatments. But even, with having that, neuro aspect being impacted at the time I didn't even know what was like really helping. And so looking back now, I'm like, it's hard to remember what exactly I did, and it's hard to recall what exactly helped. And so I can't be truly like exactly specific. Those were a couple of the cocktails that were recommended at the time, supplements, but honestly, I can't even tell you which exact supplements were the ones that I took. I had gone through so much, and at one point I was on 80 supplements. So I wouldn't even feel comfortable sharing what supplements I took, because I think everyone is so specific and there's so many different treatments that I wouldn't be able to say this is exactly what worked and this didn't.
Well, thank you, Lindsay, for being so honest. And I totally appreciate that and understand what you're saying. But I do want to now ask, as a follow-up to that, how long were you on these supplements for? Even if they were rotating, things in and out of this collection of things you were taking to heal, and give us an idea as to how your health improved over time with Dr. Taylor.
So what I did with Dr. Taylor and what our goal really was, and, together we tried things. Some things made me feel worse. And, he's very flexible and he's very open, and he knows, like, okay, if this is too much, we stop, or if this doesn't work, and I always had that open and transparent conversation with him. We got to a point, I think it was, honestly, about 6 months into the treatments and all the different supplements I was taking. At one point, I just couldn't take anymore. I couldn't physically take any more supplements. I wasn't feeling better. At one point I was suicidal, and, I was having these herpes reactions, and I didn't know what was working. I was confused. I was disheartened. And it's even hard for me to think about now what exactly, like, how much was I able to treat? How much of that Lyme bacteria was I able to, really treat? How much was I able to detox? I don't know, to be honest, I do not know if there is a time where you're like, okay, you're fully detoxed, so now you can live your life again, right? We judge our prognosis, we judge our illness by, yes, lab results, but also by how we feel. And so I was still feeling so crappy at that time, like 6-7 months in. And I know that we worked really hard on, doing that fair amount of detox and treating. Was I feeling better? No. And that's when I really started to think about what else is there? What else can I do?
So, Lindsay, were there any improvements? Meaning, were you just still neurologically impaired, but there were some gains in other symptoms that weren't neuro-related, or were you just overall whole body not feeling better in general?
The latter. I would like to think that treatment and like detox wise, I was doing good for my body, but I could not feel it. I could not feel the positive results.
One of the things that I think is not talked about enough in the community is when we're that ill, and I can relate to being that neurologically impaired, it's hard for us without a loved one to communicate with our medical professionals how we're doing, because we are so limited cognitively when we're in the throes of it. So how are you communicating with your doctor, or not communicating with your doctor, that you weren't getting better and what was going on with your health over this 6 to 7 month window of treating with Dr. Taylor?
I think how I kind of communicated with him, my husband, my partner, like very, very open to helping me communicating with, Dr. Taylor, and he was very helpful in that, my family played a role too, my mom, my sister, and they would help communicate to Dr. Taylor. And sometimes I would feel okay, but then it would go away, right? And then I would plateau again. And so I would see him and I would have good news, and then I would plateau or get worse, and then I would have bad news. And so, he was very compassionate in that he took my phone calls, and, he was really understanding. And the thing about him was he didn't give up, and he always was looking for the next thing, whether that was brain retraining, whether that was like something totally weird and off grid. And he was like, why don't you go and try this? And that's something that I can always appreciate, is even though I didn't physically feel better, like he had that growth mindset that I needed in order to heal.
So now the 7-month window, you're just trying thing after thing after thing after thing and not making progress. And then what was next ultimately? So you said you had to look for that next thing to heal, and you're about 7 months in. What was next after this time period?
At that point, I had kind of, been talking with a lot of different people. I had gone to like a support group. I had, gone on social media. I had tried, just kind of went to all of the resources that I knew. I talked to people who maybe had dealt with Lyme disease or something similar. And so I was trying these different things. I had started therapy. I started biomagnetism treatment in Buda, Texas. I just kind of was doing anything I could. I was seeing a chiropractor at that point. There were just a lot of different avenues. Like every day I was going to an appointment and surviving and, really trying to live. And that's the point that I found out about brain retraining. And I read it on a blog post, and about inflammation that occurs in the body as a result of the chronic stress response. And to me, I needed an empowering tool that I could use at home. I was tired of these passive approaches and outsourcing my health to all of these different practitioners. And I think we can feel so disconnected from ourselves, so disheartened by our bodies. Why aren't I feeling better? I'm doing all the right things. I'm trying so hard, and I still feel this way. What else is there? And that's where I was. And, learning about, okay, the brain is always communicating with the body. And when you're stuck in a state of chronic stress, that's physiologically being communicated to the rest of the body, and the body's responding. And I thought, yeah, that makes a lot of sense. Because in my mind, I'm thinking, why aren't all of these things that I'm doing working? Why aren't I feeling a difference? And, so having something I could use at home and do myself was something that I really wanted to do, because I felt like going from appointment to appointment and outsourcing all my health, health, my healing, it was so tiring. And I felt so disconnected, and frustrated and angry and sad and all the emotions. So it was an approach that really resonated with me in that way.
So clearly brain retraining, it was pivotal in your healing journey. But I want to just ask you a question up front about this, because one of the things we hear all the time, and I think because of medical trauma and because of being not believed by doctors, when we hear something about brain retraining, we think about therapy and it's all in our head. And I'm having a hard time understanding the difference between saying is it in your head? And I know your answer, Lindsay, to that is no, it's not all in your head. But then saying your brain is sending signals to your body based on chronic stress and chronic illness. But if you still have pathogens, if you still have Lyme bacteria and mold exposure and mycotoxins and environmental toxins in your body, how is treating the brain going to heal your body? And that's the part that I'm a little fuzzy on. So can you elaborate on that for us, please?
Yeah, absolutely. And I'll be the first one to say, I don't believe simply addressing the brain is the only way to go. The body does need to be addressed. The physical body, when we have a cut and we have an infection, that's here on my hand. The brain is the communication of the body. This is like the epicenter for the body, able to tell the body, like, yes, you have a cut on your hand. Let's send inflammation there. Let's send information as well in order to address this. And so there's always this brain and body communication happening. So I think it's all in your head when practitioners say that, they're really referring to the psychological component, the stress response. You are stressed out. You're just stressed out. I hate that. Because it's not just that you're stressed out, because that puts the blame on your psyche, your, psychological health. And it's not only that, the nervous system plays a big role in this, and it's not your fault. And so saying it's all in your head, in that context that a lot of practitioners say it, is just addressing that psychological component, but it's not. It's the physical, it's the mental, it's the emotional, it's the brain communicating with the body. And yes, there is that brain-body communication, but the body communicates right back to the brain. And so it's this combination of the brain and the body always communicating with each other. So if you break that down, you're stressed out, and you think of that word stress, and then you think of the word chronic stress. And so that's not just stress that exists here and solely here. We know this information we've learned within the past 2 decades of learning about neuroplasticity and the malleability of the brain and how the brain impacts the body, and parts of the brain that light up when we have certain thoughts or we feel certain things. This communication is always taking place. And so there's no localization happening in the body. To say that the brain, it's all happening in the head, means that there's a disconnection from the head and the body. And that's just not true. And now we have the information to prove that. It's the communication, and it's always happening, whether we're conscious of that or not.
So can the brain or the nervous system gets stuck in a state of fight or flight even after an infection has been cleared? Meaning, if people are able to successfully manage the Lyme bacteria, and whether or not you believe you can fully clear it or not, if you're managing the bacteria and your immune system is healthy and is no longer a viable threat, can your mind and can your nervous system and can your body get stuck in fight or flight, keeping you symptomatic even though your immune system may be managing the pathogens better than before?
Yes. And that's very well what could have happened with me. And that is what's so amazing and terrifying about the brain, is that the brain can be communicating danger when no danger is present. So we see that, when people have PTSD, they come back from war, they've experienced a very traumatic situation, and that's replaying in their heads, in their bodies, back at home in a safe environment, right? What we can logically perceive as safe, but it's not about the actual physical danger that's present at this point. Our brains are malleable, they're neuroplastic, they're always changing, always rewiring. And so, brain retraining, this term, it kind of is a little bit confusing because we're training our brains all of the time. Your listeners are training the brain every time they listen to an episode on your podcast. We're doing it every day, all day, and we're not aware of it. So this process, it's intentionally changing the brain for a way that helps you to feel good. And so really communicating to the brain and the body, like, this danger is no longer present, and we need to connect to that safety in our lives in order to feel good. So that's often the people that I work with today. That's very well what could have happened with me. They've seen all the practitioners. They've been through the ringer. They're still symptomatic. That's not always the case, but it could very well be what's going on, is the brain is still communicating this danger that's present, and the body is responding in this symptomatic way.
And Lindsay, I think there are a lot of people that are in that particular situation where they've done everything and their body may be in a good place, but they're still symptomatic. And I know, you talk about all the time how if you're in a persistent chronic state of anxiety, fatigue, pain, dizziness, stress, and even more things like that, and you're not making improvement, you should really look at brain retraining and neuroplasticity, which I want to ask you more about that term as well. So I just want to take a pause here to say, if people are listening and they're in that situation, they really should reach out to you on, it's Vitalside. Is it vitalside.com, Lindsay?
Vital-side.com.
Vital-side.com to learn more about your programs, because I think that is the missing piece of the puzzle for many people. And we've been told by a lot of people that they were in that same situation you just described, where they've done everything and they couldn't figure out what was missing. They have done a brain retraining program and they finally got their health back. So I think that's a really powerful piece, and many people need that and don't even know that's what's going on in their bodies or in their minds or their brains. So, but talk to us about neuroplasticity, because it sounds like a really intimidating word, but I think it's a really powerful word. And we keep saying brain retraining, but to me, it's almost like the reverse, like we're unlearning this response to something bad going on in our bodies that is no longer there. So we have to kind of unlearn bad behavior in our brain, or unlearn this bad reaction to bad things going on after it's gone, right? So for me, it's kind of like a little backwards, right? So what is neuroplasticity and how is that connected to brain retraining and the programs you offer?
So neuroplasticity, so neuro meaning of, related to the brain, plasticity meaning malleability, ability to change. And so our brains change so fast within milliseconds. And so we learn a new fact, we quickly learn how to strum, this chord, strum on the guitar. We learn that our brain is making a change. We're creating new neural pathways in the brain associated to this new task. And that's how fast our brains can change. But in order to create long-lasting, sustainable changes, we need repetition, we need time, we need consolidation, we need sleeping on, this new information, implementing and integrating this information into our day-to-day lives. And so, whether you want to call it brain retraining, rewiring, unlearning, there's so many synonymous terms, because it's this process of kind of understanding the brain is responding in this way: danger, survival, sympathetic dominance. Okay, now that we have this awareness, how do we then get to that ability to connect with safety, parasympathetic dominance, rest and digest? How do we connect with the neurotransmitters that make us feel good, the serotonin, the oxytocin? This is likely something we haven't been able to connect with in quite some time. And I want to kind of pause for a second and just clarify the difference between mindset and the nervous system, because I think a lot of times this can be very confusing for people. Having a positive mindset, we hear a lot about toxic positivity. And I think oftentimes there can be this confusion of like, oh, well, if I think positively, then I will feel better. And then a lot of people say, well, hey, wait, that discounts the very real emotions that I have, the grief, the sadness, like the pain that I feel, right? The symptom that I actually experience. And so what happens is mindset is a different part of our brains. So with the nervous system and how it's impacted by a trauma, what I mentioned earlier was the autonomic nervous system. And then what's also impacted is our limbic brains, our emotional, mammalian thinking, reacting brains. We have reptilian brain, we have that mammalian brain. These are being impacted as a result of a traumatic situation. And so then that limbic brain, that emotional, that feeling, that reactive brain, all of a sudden, that's the one responding instead of our, neocortex, our prefrontal cortex, our decision-making brain, our, fully functioning, like this is how we make a decision that works for us. That no longer is the one that is primarily responding, right? It's our kind of primal, natural survival response. That's what's happening. Our emotional brains then are also dominant and responding in this way. Our stress hormones are being released. And so what happens is we need to address those parts of the brain. We need to regulate our nervous systems, becoming aware that these responses are very real. It's nothing that was your fault. It's nothing that you did wrong. It's a survival mechanism that is something that is meant to help us and keep us alive and sustain us as humans. But right now it's stuck in this chronic state of stress. So being able to address that limbic brain, being able to address the autonomic nervous system, slowly shift out of that survival state. And we take steps in order to do that, in order to shift that response. But what happens is, as a result, when we begin to shift out of this state of survival, we don't even have to directly address mindset. That comes later. And so that's not the piece that we lead with, because our prefrontal cortexes are responsible for that kind of mindset shift. And so we're not primarily responding in that way. We need to address, the autonomic nervous system. We need to address that limbic brain first. And then later on, then you may, okay, well, these tools that I'm using, these mental exercises that I'm using in order to address this survival response are helping me to connect with like feeling a sense of calm. Okay, maybe that kind of feeling comes first because we're dimming down that limbic response, that emotional feeling reactive brain in that hypervigilant, hyperinflammatory way. And we're connecting with that state of calm. Okay. Then perhaps doing that regularly can lead to like feeling more calm in your life. And then maybe you're able to connect with feeling a sense of gratitude, right? And then that mindset shift occurs. But the nervous system has to be addressed first. And so if you're listening to this today and you're thinking, I can't think positively, I don't feel good, I can't connect with anything good that's happening, that's not your fault, and you're not alone in this. This is the nervous system responding, and we can shift and change the nervous system first before we address that mindset piece. And that will come, and that can come as a result of this retraining.
Lindsay, I just want to tell you that that was one of the most powerful things we've ever heard on this podcast. And thank you for taking time to stop and explain that to us, because that is brilliant. And I think that needs to be shared with the entire community and yelled from a mountaintop, because that is really important information that, frankly, I didn't fully understand until you explained it. And I think that's really, really powerful content that needs to be shared more. So thank you for that. Now, I do want to ask you a quick question, though, because in your website and in researching, a lot of the work that you do, you talk about neuroplasticity. Not only can it change the patterns of your mind, but it could also influence change in your genetic expression. And we recently interviewed Bob Miller, as Rich had noted earlier, and he really focuses on genetic expressions pertaining to chronic illness, but specifically chronic tick-borne illnesses and chronic Lyme disease. And he goes over the top dozen or so genetic mutations that are common in chronic Lyme patients and chronic tick-borne illness patients that need to be looked at to help them overcome some hurdles in their healing journey. So I'm curious about the overlap between the work being done by Bob Miller, which is his cutting edge genetics works for the chronic Lyme community, but also combining that with your neural plasticity and how it can change your genetic expression by using brain retraining, and how they're related, if they are at all.
Yeah, so definitely related. And what I see is this symbiosis happening, because someone like Bob Miller, who is doing a lot of research and kind of understanding this information, very, very important. Another subset of that is understanding the concept of epigenetics, the ability to change your genetic expression. And simple example here, when a stressful event occurs and that cortisol is released in our bodies, our basically hormones are able to go through into the cell, and through this process of transcription, able to communicate to our genes how to be expressed in new and different ways. That's what cortisol does. That's what dopamine does. And so, cortisol being, your major stress hormone, dopamine being a feel good, happy neurochemical that gets expressed when we laugh. And so being able to connect with those feel good neurochemicals actually shifts and changes the way your genes can be expressed, and so do other things. And so I'm just using this one example. Environment changes that, there different things that we're exposed to. There's so many things that can change our genetic expression. But what I always look for in my practice is what is possible for me, right? What am I able to shift and change? So, maybe you're not able to shift and change your high stress job that you're working 9 to 5 at, but I'm able to change what I pay attention to on my lunch break. How can I release feel good neurochemicals that can make a difference in the way that my genes are being expressed? And it can be as simple as choosing to watch a funny stand-up, your favorite comedian on your phone, and laugh and actually express that neurochemical and have that be a process that actually takes place in your cellular structure to make a change. And it is, there are some incredible people out there who are studying this and have written amazing books, like Dr. Bruce Lipton being, a huge player in epigenetics. And I think just simply the concept of knowing that we can make changes to our genetic expression is so powerful within itself. And that's what I'm always looking for, is empowering tools that we can use at home to make those shifts. So that can play a huge role in the work that Bob Miller is doing. That can be a symbiotic, relationship of like identifying those things. How can we change them? What can we do to stay ahead of that?
And I think this is really important information, because we've been challenged the past several weeks when we start telling people about how your genetic expression can be contributing to your chronic illness. And then people get upset and say, well, wait a second, I can't control that. That's how I was born. And our response is, well, there is a couple of factors there. The first factor is you can offset the genetic mutation by using supplements and diet and food, but there's also ways to look more upstream and hit it from a more upstream approach as well, that Dr. Miller talked to us about on his podcast, which is really the second area. But now you're giving us a third area, which is using brain retraining and neuroplasticity to control the expression of your genes to overcome some of these genetic mutations and allow your body to heal, right? So when people think, I don't want to hear about genetic mutations, or I don't want to hear about genes because I can't control that, you really can. And it can be a powerful tool to help you overcome your illness. So I think that was a really nice addition to what we learned from Dr. Miller. So thank you for that piece of it. So I do want to circle back now to your journey though. So you find out about brain retraining on a blog, and you start to probably geek out and learn all about it, clearly, because now you're like one of the leaders in this community. So tell us about what you learned and how you applied it to your own healing journey.
Well, first, I took it day by day, because like you, I had trouble reading. I was like, okay, I'd read like a paragraph and I'd be like, okay, don't remember that, got to take a break. I did get my hands on, audiobooks were the way that I went at the time. That was something that was really important to me. And I think I mentioned this earlier, I'm a very 0 to 100 person. So I was like, okay, even in this state, I'm like, all right, this is what resonates with me so hard. I need to figure out how I can integrate this and apply this to my life with the capacity that I'm at today. So I always took that approach, like, okay, day by day, what is possible for me? What can I include in my own healing? So I read as much as I could. I think one of the first people I started with was Joe Dispenza. Then I went to Candace Pert, Molecules of Emotion, and Bruce Lipton, Norman Deutsch, audiobooks. And then I wanted the application. And I, started to find different programs, figure out what was actually utilizing the application method of some of this information that I was learning, and it was interesting what I learned. And even through books like, Dr. Jeffrey Schwartz, he talks a lot about OCD, and he has this 4-step approach that he was using on people with OCD. And it was just, okay, cool. I'm learning about the integration piece. And to me, that was so important. And with the listening and the work, I started to kind of apply it to my own life and figured out what really worked for me. And I'm a very kinesthetic, physical learner, and I'm also auditory, and I'm also visual. Like I like all of the things. I like this immersive experience. And so I really kind of started to utilize a lot of what I learned and figure out creative ways to kind of integrate it into my own life. And I did, and I'm very thankful for, my research. I'm thankful for the programs I did. I am thankful for learning. I ended up throughout that time taking, when I started to feel better, I started taking a neuro-linguistic programming course, because I was like, I think a lot of this information comes from here. I want to learn more. So I started doing that, and however much I could, just little by little, step by step, day by day, as much as I could, as much as what was at, my capacity. And I did. And, within a couple of really weeks, I started to notice a shift. Like I went to a neighbor's, I live in Texas, right? So I went to a neighbor's crawfish broil in their backyard, and I was there for 30 minutes. And I remember looking around, and I had this like epiphany, and also this like moment of panic. I was like, I'm at a social event for 30 minutes. And I haven't thought about my symptoms once. I haven't experienced a symptom. This is amazing. I better go back home now. And I did. And I went back home, but I was just so thankful that I was able to get out and to do that and have that experience. I was over the moon. And I think it was at that point where I thought, yes, like there is something to this, right? There, like my brain is being impacted, and this is huge. And I need to learn more. So that's what, continued my journey for me. And, this isn't for everyone, but that's when I started to retrain, getting off of some of my supplements, eventually getting off of all of my supplements, and, starting to connect with my physical body and movement. Before I got sick, I was really big into yoga, and I would do headstands and, a lot of very active stuff. And at one point I couldn't move my arm to reach over my head to wash my hair. And so that's where I started, y'all. Like people say, well, where do I start? Start with where you are today, how you present today. This is where you start. There's nothing you have to do other than show up for yourself. Be here with yourself. Know that, okay, I can't wash my hair. I can't reach my head over my hair to wash myself. That's where I start. And I was learning these mental exercises. I call them mental exercises, though they're much more than that. They impact, like the physical body, visualization techniques, mental rehearsal, these types of techniques that were so beneficial. And that's where I started. I started lifting my arm. I couldn't lift, right, 90 degrees. And so I started at 60 degrees. And then I'd go through this mental rehearsal, training my brain, training my body to feel something different, to move in a different way. And I trained in that way in order to get to standing on my head again. That's where I started. And it did take me about 9 months. But that was my process, and that was my journey. And little by little, every day, I use these mental exercises to eat the foods I wanted to eat again. I wanted to eat a pizza. I wanted to drink a beer. That's what I wanted to do. So I was like, okay, that's what, these are the things I want to do. I want to get back to food. I want to get back to life. I want to be able to go to a friend's birthday party and be able to have a piece of cake and not worry that this is something that's going to impact the rest of my body. I want to be able to travel, to move my physical body, all of these things. And that's what I did. And so it did not look perfect. It was not linear. And there were times I had to do a lot of experimentation to figure out, well, what can work for me? How can I change this? What can I do differently? But ultimately, it was that consistency, that repetition, that commitment. It was me committing to myself. This is the life that I want, that I deserve, that I am going to live. And so I'm going to train myself to get here, physically, mentally, all of the things, emotionally, using these exercises. And sure enough, that's what I did.
So I just want to put this in perspective again. So you were so neurologically impaired, you could barely communicate. Well, you couldn't even communicate with your doctor. You were not able to really read, you'd noted, right? You could only listen to audiobooks. You couldn't lift your arm beyond your chest. So you were very physically limited as well as neurologically limited. And I know from your pre-interview questionnaire that after 8 months of brain retraining, you were surfing on a beach in Costa Rica and able to eat, drink, and do anything you wanted, right? I mean, that's really, really powerful. So, I mean, talk to us about what life was like after that 8 to 9 months and you realized, oh my goodness, I have my life back. Like what kind of epiphany that was for you?
Yeah, so I do want to just point out at that point when I was doing that, I was nervous. I was anxious. It does not look perfect. Like it's scary. Healing is scary when you have been living like this. I say, yeah, my story of healing, it was a little over a year, which in the scheme of things is such a small amount of time, but it feels like forever. No matter, if you've been dealing with this 20 years, 50 years, 4 months, like this is your life that's being impacted every day. And so it is a significant chunk of time, no matter how long you've been dealing with this. So it was scary. It was so scary. I was in Costa Rica and I was like, okay, taking it easy, we were talking about earlier with Rich, like I was like, okay, now I'm prioritizing my health. Like I'm putting myself first. This is scary. Let's take some surfing lessons. And we did. And I was surfing and okay, let's eat a pizza. And okay. And it was incredible. Like the best pizza I've ever had. Everything I was doing, there was a little bit of anxiety to it. Like, and then there was this just absolute gratitude. And the fact that I was there, the fact that I could do it, like, it still brings tears to my eyes because there's not a day that goes by that I am not so thankful, for my physical body and the power that I have, my brain, my nervous system, like, and that's what's so incredible about this work is you are so naturally resilient. Our bodies are designed to live. Our bodies, our nervous systems, they want you to live. And so being able to connect with that, and how I kind of put it is set your brain and body communication up for this sustainable environment so the rest of your body can function. You can access that parasympathetic growth and repair response. Your immune system can start to work for itself. You can start to digest food. There's so many systems that you're setting up for success. And that's what we're doing is we're providing our bodies with that environment, that communication in order to do that. And so, yeah, not a day that goes by that I'm not thankful. And so I was there, I was scared, and I did it anyway. And then when I got back, when I got home, when I got to the States, I was like, okay, anxiety for me was the last bit to go because that was something that hypervigilance had kept me aware. And I wanted to make sure that I was able to function. And so that anxiety was there again for a reason, but I kept retraining, I kept learning, and I kept up with the tools. And I got to a point then where I woke up one day and it had gone away and I was living life. And so that, I don't know if that was like a specific epiphany of when that happened. It was kind of like I was living life and I was functioning, and that was incredible. And then I think a couple months later, I was like, oh my God, I am living life. Like, this is insane. I'm so thankful. And then I've got to do something with this, right? I always knew I was going to do something with it, but that's when I was like 100%, this is something I need to commit time to doing. That's when I learned more. That's when I started kind of non-professionally coaching with people in groups that I had just randomly met throughout my experience. And I always say VitalSide has always been this entity within itself. And I'm just kind of the, I'm kind of the facilitator of this work. And that's how VitalSide was created. I will say that after that year, like that next year, I wanted to challenge my body in every situation. I went skydiving. I walked across hot coals. I wanted to do all the things to make sure I'm like, can my physical body do it? Am I able for it? And again, that's my personality shining through. And when I got that evidence, right? We're always looking for evidence for possibility, or evidence that we can, evidence that we can't. And I had that evidence, and then I felt satiated, and I was like, okay, this is wonderful. So, personally, body feels good, feel that strength, feel resilient. And, VitalSide was created as a result of me knowing that this information is so pertinent, having been a medical practitioner, and knowing that there is a bridge that was necessary, that was needed between this concept of neuroplasticity, the brain retraining world, and the medical community. So that was my initial drive to start VitalSide, was I want to bring this into medical offices so that practitioners know that this is an option for people. And they can do it alongside of something that they're already doing. They can do it alongside of addressing the physical body, and then that can be that perfect combination. So that was really, really important to me. And that was my very first, that was my first kind of thought in creating VitalSide, was like, let's bridge that gap. Let's integrate this information that we read about in books and apply it to, this healing process. And so VitalSide was born.
So Lindsay, let's talk about VitalSide and when people should be going through this neural retraining. And the first time Matt and I heard about neural retraining was when we interviewed the author of the Parenting with Lyme Bible, Dorothy Leland, who's also the vice president of LymeDisease.org. And what she said was that her daughter didn't get better until she went through neural retraining, that she went through this long and lengthy process, but she still was symptomatic. And then she went through neural retraining, and that's when she finally got her life back, right? So that was the first time it was put on our radar. And the question that Matt and I have been debating for a long time is, all right, well, when do we do this? Do we start the neural retraining immediately as part of an emotional detox? Because Matt and I have been spending a lot of time sort of like coming up with this outline of when you would begin to socially detox and emotionally detox and physically detox and environmentally detox. So is this a part of the early element of healing, where you're using it as part of the preparation element, or is this something you do at the end after you've gone through all of the treatment the way you did, and you have all the support that your immune system needs to kill the microbes, and then ultimately you use this as the final piece to retrain your system so that it's not stuck in the fight or flight mode and no longer symptomatic, despite having all of the damage that was being done by your body, all the microbes causing the damage being killed?
Historically, that latter version is what has been going on. But I think it's because brain retraining, now this is trending. Now people are talking about it. Now practitioners are applying it. And so people are hearing about it more. And I think people in this world, like experts in the brain retraining world, have notoriously used it for people who have tried everything else. And okay, now it's time to use brain retraining. That's not what I would recommend. what's cool, what's kind of interesting, it is unique for every person. But I think what you need to kind of figure out is, am I at a place where applying a daily practice, even if it's 5-10 minutes, is possible? And that's kind of the question to ask. So a lot of times that is kind of, a couple steps into your healing from Lyme journey. And I say that because throughout my years of practice, what I've understood is there are some people that come to me with this idea, like, I want to use this information, but, I can't be on a computer at all, or I am, detoxing from all these different co-infections, and, I'm in bed and there's not much I can do. And so it's up to you to discern for yourself, can I commit 5 to 10 minutes a day to listening, to just being present with this material? Is that a possibility for me? And so there is an opportunity for something like a passive form of neuroplasticity that can be used. So passive neuroplasticity, meaning you aren't necessarily the one that is consciously using your brain to make these changes. And often that consists of neurofeedback, some sort of biofeedback. Is that an option first to kind of help you to start to feel a little bit better so you can commit that 5 to 10 minutes? Active neuroplasticity is what I do and what a lot of other brain retraining programs commit time to. And that is required for you to have attention and then really to integrate it into your life as well, because without that integration piece, it's not going to work, So I think, just from kind of thinking about this myself for many years, this fits into maybe 20 to 30% into your healing journey, then is this an option for you? Because typically maybe by that time, the active neuroplasticity piece is a possibility.
So one of the reasons I've been so excited to interview you is because what we learned from Dorothy Leland, for example, was when her daughter went through the neural retraining program she had gone through, that it was this rigorous program that took her a long time, I think over a year, to ultimately succeed. And she said she had to be really Spartan about doing it regularly and aggressively and in this sort of lengthy fashion. And the thought that I had at the time was, well, how would a sick person be able to do that, right? And then we've heard again from other people who have done some of these other neural retraining programs that, it's just a huge commitment. It's just a tremendous commitment. And a lot of people hadn't been able to, make that commitment either because of the place where they were emotionally or physiologically or a combination of all the above. And it sounds like you've come up with a more refined program. And that's why we want to, and it's sort of a program that doesn't require that kind of a lengthy, either on a daily basis or on a lengthy, a time basis to have success with this. So talk to us about how you learned from your experience about how a commitment should be made in sort of a bite-sized fashion rather than on this, this much larger basis.
That was really from personal experience and from that period of non-professional coaching, because humans can commit to a bite-sized thing, right? You think of 5 minutes, you're like, well, I could do anything for 5 minutes, right? That's how our brains work. And so I see the benefit of a fully intensive, immersive experience, right? It's like going on vacation, Charles Duhigg, author who talks a lot about the power of habit, being on vacation, that is an optimal time to change habit, because everything is changed in your environment, in your routine. The cues are changed up, the reward systems are all changed, so you can easily break a routine habit. And with an immersive experience, what you're doing is you're getting this intense overhaul of, almost this like jolt to your body, to your nervous system, to shift and to change. And there is value to that. And through my experience, what I found is that can lead to rigidity and ultimately this obligatory association to the process of brain retraining. And of course, that leads to, obligatory, okay, this negative association to brain retraining, which you're supposed to be doing this thing that's supposed to make you feel good. And to me, that is a bit of an oxymoron. So thinking about how to structure brain retraining, like I've gone through, different ways to structure it throughout VitalSide. And so now I'm at this point where I think a lot of people who are attracted to VitalSide in particular, they're kind of these intuitive brain retrainers, and they want to take one thing at a time. I think naturally I have that kind of gentle, soft approach. I'm not going to boot camp you into this brain retraining program. And I think people know that, and they appreciate, and they're kind of, driven by that approach of like, okay, if I do one thing a day, if I make this little change and then this little change tomorrow, I'm about consistency and sustainability for the long term. So you create these lasting changes, which is why a lot of things, outside of the brain retraining world, fad diets, these types of things, intense immersive experiences that you commit full throttle to within a week, and then you gain the weight back or whatever, maybe you had good experience and then you gain the weight back, right? There's all these things we've done in our lives that are like very immersive and intensive, but they don't create the long-term sustainability, and they don't have a plan for you to integrate it into your life. And to me, again, integration is key. Application to how this applies to my life in a structured way, because that's how humans think, without creating that sense of negative rigidity that requires me to do it in this way and this way only. So I see the benefit of both. VitalSide happens to be this sustainable, consistent approach. There's still recommendations, like general recommendations that I make. Like I tell people, okay, yeah, having that like 5 to 15 minutes a day, starting somewhere in there and committing time to watching the videos in that way, but doing it every day. Right? Having that bit of structure to it. And then, tools that you can use in the moment you experience a symptom, so that you can start to create brain retraining as a lifestyle rather than a consolidated practice that is meant to fit in this time slot at one period a day. Again, we are retraining our brains all the time. What I'm doing is just teaching some exercises to intentionally retrain your brain so you can connect with optimization of self, feeling joy, feeling safe, feeling good, and doing the things you want to again. That is my long-term goal for everybody. So a lot of people, yeah, they resonate with that approach, that daily, consistent approach.
As much as I would love to continue this conversation, because I really have so many other things that I'd love to talk with you about, this is date night, and I don't want your husband to get upset about us pushing you already 30 minutes past the start of date night. So I'm going to ask you our final question. If God forbid your husband came walking in the room right after this podcast, and before date night started, and you saw on him what he saw on you, which was a tick biting him, what would you recommend that he do so he wouldn't have to go on a chronic Lyme disease journey?
So the very first thing that I would do is take a 4-sided breath, inhaling for 4, holding for 4, exhaling for 4, and holding for 4. And I would instruct him to do the same thing. Okay, so now, our nervous system is in a little bit of a different place. And so I've got all my tools in my closet. I would go and I'd get the tweezers and I'd get as close to the head as possible of the tick without squishing it. And then I would put it in a little glass container, which weirdly enough, I have some of those. And I would put it in that container, I would keep it. And then I'd likely recommend that he receive some like homeopathic treatments just for his, prevention, to boost his immune system, just to kind of set him up for success, at that time. And then definitely nervous system regulation stuff alongside that.
Lindsay Mitchell, the founder of VitalSide, thank you so much for taking time out to share your beautiful story with the community we call Tick Bootcamp.
Thank you for listening to our Tick Bootcamp interview with our guest, Lindsay Mitchell. To our listeners, we have a call to action. First, if you'd like to learn more about Lindsay, please visit her on Instagram at myvitalside. Second, if you've enjoyed this episode of our Tick Bootcamp podcast, please share it with your friends on social media. Third, Tick Bootcamp has created a Tick Bite blueprint that has been inspired by the information that has been shared with us by past podcast guests. We urge you to visit our website at tickbootcamp.com to view our blueprint. Please note, we appreciate any input or improvements you'd like to share with us. Fourth, don't forget to subscribe to this podcast on Apple Podcasts, Google Podcasts, or Spotify to get your automatic episode updates of our Tick Bootcamp podcast. And finally, we thank you, our community, for your comments on our past podcast episodes. Please take a minute to leave us an honest review on Apple Podcasts, Google Podcasts, Spotify, on social media, or on our website. We make it a point to read every single one of the reviews you share with us. If you're looking for a specific episode of our Tick Bootcamp podcast, whether it be a particular topic, a particular person, or a particular location, visit our website at tickbootcamp.com/search, and you'll be able to find exactly what you're looking for. Thank you, as always, for listening.